Somewhere in southwest Michigan, there's a street called Myrtle Avenue. And for 101 years, there was a hospital on it, not a glass tower off the highway, a building in the neighborhood on a residential block where the people of Sturgis were born, were stitched up, were held at the end. On a Tuesday in June, the staff were called into a room and told the doors would lock in about 70 hours. A nurse who had worked those halls for 32 years said the room filled with shock. Then, at noon on Friday, June 19th, 2026, the doors locked for good. Here is why you need to understand this town, even if you have never heard of it. The emergency room that used to be 2 miles from a Sturgis family's door is now 25 miles away, and this has never happened here before, not in a century. And the part that should stop you cold is this: Sturgis was not on the watch list. When researchers named the 417 rural hospitals most likely to fail, Sturgis was not one of them. It died anyway, ahead of schedule. By the end of the next few minutes, you will know exactly how to tell if your town is next. Now, hold 2 pieces of paper in your mind, because both are true at the same time. The first is a government memo from last summer that calls it the single largest investment in rural healthcare in more than 20 years. $50 billion, a brand new federal office, a press release in every state house in the country. The second piece of paper is a lawsuit. On July 10th of this year, a nurses union walked into court and sued Sturgis Hospital, saying the workers who lost everything got about 3 days of warning instead of the 60 that federal law requires for a shutdown this size. So the largest rural health investment in history was signed, funded, and celebrated. And a hospital still locked its doors and did not even give its own nurses time to find the next job. If the rescue is real, how is that possible? Start with what makes Sturgis so frightening. It was not a chain casualty. No distant corporation, no private equity firm loading it with debt. It was an independent community nonprofit, and the town fought like hell for it. In 2022, the city itself loaned the hospital $645,000 to stop a bankruptcy that summer. In 2023, it became Michigan's very first rural emergency hospital, the exact federal lifeline Washington built for this crisis. Higher Medicare payments, plus a facility subsidy that runs on average across the country around $3.2 million a year. The state of Michigan piled $11 million on top of that. Think about what that means. Every rescue tool that exists in the entire system, Sturgis qualified for and used. And it still could not make the math work, because the official reasons, falling reimbursement, rising costs, fewer patients, all translate to one brutal sentence. This was an older, sicker town living on government insurance, and the hospital lost money on nearly every single person who walked through the door. So here is the honest version, the one the calm voices will give you. And they are not lying about the facts. That $50 billion fund is real. Every state applied, every state got an award. Some rural systems will genuinely modernize because of it. If your local hospital is stable, this money helps. That is all true. But look closer at what the money was actually built to do, because this is the whole game. The fund pays states, not hospitals, and it was written for innovation, telehealth pilots, workforce training, technology upgrades. In Montana, out of $233 million, only $82 million was aimed at keeping hospitals financially stable at all. The rest went to everything else. Meanwhile, the same law that created the fund cut $137 billion out of rural Medicaid over 10 years. The fund covers only about 37% of that rural cut and barely 5% of the national Medicaid reduction. The man who runs the Center for Healthcare Quality and Payment Reform said it as plainly as anyone can. Even if every dollar went straight to the hospitals, it would not offset the cuts in the law, period, because the fund does not fix the actual wound, which is that these hospitals lose money on the patients they serve. The rescue was never engineered to keep a dying hospital open. It was built to help the healthy ones get healthier. Hey everyone, real quick, if you want to change your entire mindset when it comes to money and you want to go from losing to winning, from failing to success when it comes to wealth, links down below for the Money Mindset Mastery program. It has helped so many people. We've gotten rave reviews about it. Now it's time for you to jump in and crush it. Money Mindset Mastery, links down below. Now let's get back to this video. And that is exactly why this keeps happening, because the lifeline has failed on contact before. In Holly Springs, Mississippi, a hospital won that same rural emergency hospital status in 2023, and then federal regulators later took the designation back. The safety net gets announced, then quietly pulled, then studied after the funeral. This is not new. Back in 1983, Medicare switched to paying a flat rate for each patient, no matter what the care actually cost. And thin-margin rural hospitals were the first to get squeezed. Hundreds closed over the years that followed. Congress invented one rescue label in the 90s to slow it down. And it did slow, but it never stopped. The line runs straight from that rule change over 40 years ago to the locked door on Myrtle Avenue. Sturgis just ran the arc faster than anyone expected, from Michigan's success story to a closure notice to a courtroom. Now watch how far the damage travels, because this is where it reaches you, even if you never set foot in that hospital. The town's public safety director said it simply: ambulance trips that used to run 2 miles now run 25. And an ambulance tied up on one long haul is not sitting in town waiting for the next emergency. So the next call waits too. Research on rural closures shows transport times climb in the year after a hospital shuts. And for someone in cardiac arrest, the odds of survival fall by several percentage points for every single minute lost. Do that math with your own family in the back of that ambulance. Then the money follows the sirens out of town. In counties that lose their hospital, healthcare employment drops by almost 14%. Income per person falls around 4%. Wage growth afterward limps along, near 1% a year in places where it runs 3% everywhere else. Because one rural hospital is about 170 jobs and roughly $7 million in wages. And it is almost always the largest or second largest employer for miles. When it closes with 3 days' notice, 300 paychecks stop on the same afternoon. And so does every dollar those families spent at the diner, the pharmacy, the gas station, and the hardware store. The hospital does not just take the emergency room when it goes. It takes the paycheck the whole town was standing on. This is the pattern, and it is national now. Researchers count 417 rural hospitals currently vulnerable to closure. Tennessee is the worst, where 61% of the rural hospitals still standing are on the list, up from 44% just a year earlier. Texas has about 50 at risk, Kansas 44, Georgia 25, Mississippi 24. 21 counties in Tennessee already have no hospital at all. And separate trackers now count roughly 200 rural hospitals that have already closed or dropped inpatient care since 2010. This is a wave that has been building for a decade, and it just accelerated because the Medicaid cuts are only starting to land. So here is what you do, and I want you to do it this week while it is still a choice and not a scramble. If you take that largest investment in history language at face value, you will trust a fund built for the strong to save the weak. So look up what your own state actually did with its money. How much went to keeping hospitals open versus everything else? Because Montana spent barely a third of it on stability. If you assume your hospital's federal designation means it is safe, you will get blindsided the way Sturgis was, so check its real status. Remembering that a conversion to that emergency hospital label is a distress flare, not an all clear. If you wait for the closure to hit the local news, Your window to prepare is already gone. So pull your own county on the public rural closure tracker and read your state's vulnerability table today for free tonight. And if you have been treating the anchor employer in your town as permanent, understand that 300 families in Sturgis just learned it is not. So build a second stream of income now, while the hospital is still open and the decision still belongs to you instead of a closure notice. Because here is where this ends. Go back to Myrtle Avenue. Economic Ninja is out.